So I want to talk a little bit today about autologous stem cells. And autologous in this case means coming from your own body. There are different forms of stem cells out there. One form that we discussed in another video are amniotic stem cells, which are taken from the placental layer or the inner layer of the placenta. After a baby's born, the placenta is donated and we use that. And that works well for many people. Some people decide that they don't want to go that route. It can be personal conviction, it can be religious conviction, something else. One way you can harvest stem cells is from your own body. We always think of stem cells as being something that only babies have, or an unborn baby has or a new baby has, and that's not true. We have stem cells in our body. They're just dormant for most of our body. Now, there are some cases where stem cells will help regenerate damaged tissue, but they're not that easily accessible. They're trapped often, for lack of a better word, in different tissues, and there are two tissues in particular that tend to have a higher reservoir than most. One is your bone marrow, and the other would be your adipose, your fat cells. So when you do autologous stem cell therapy, you're basically doing a trifecta. You're drawing some blood because you are going to put that blood in a centrifuge and spin it down and get what we call that PRP, platelet-rich plasma, which we've discussed in another video. That's the fluid component of your blood, and your platelets, which are chock full of growth factors. Think of them as fertilizer, basically, when you're trying to feed something, that are very, very helpful in helping feed those stem cells and helping the healing response. You will harvest some of them from your bone marrow. And the typical way you get stem cells from the bone marrow is very much how the cancer doctors do it. Say like you're being a bone marrow donor for someone who has leukemia. They'll typically get it from the back of your pelvis. So you typically lie down, and once the area is put in you put a sterile drape over there and you wear sterile gloves. You numb the area up extremely well. And once the area is completely numb, you find this bump on the back of your pelvis called the posterior superior iliac spine. If you run your hands down below your back, you'll feel a little knob on each side of your pelvis, and that's where you go in. You take an ultrasound machine to confirm you're in the right spot, and you basically just slowly push and push and push, and you punch a little hole right there. And once you do that, you take the hole punch out, the piece of metal, you leave the tube, and you just draw some bone marrow out. You can do without that. Your body will regenerate that. So you're not damaging anybody by doing that. Once you've collected the bone marrow, the last thing you do is you patch that up and you turn the person over, and you take wherever the largest reservoir of adipose or fat cells are. Now, for most people, most of us, a lot of us can lose a little weight. It's a great place to get it is the abdomen. So think of it as a mini liposuction. Now, you're awake throughout this procedure, but you are numbed up. And it's very important that you're awake, because if you're feeling something odd or weird, or you have an odd sensation, I don't want to find out about it when you wake up. I want you to tell me right then and there. So what you basically do is numb up a large section of the abdomen under the skin with a little lidocaine. We put a little epinephrine in there, because epinephrine will make sure it clamps down on the blood vessels so there's not a lot of bleeding. You make a tiny incision, you put a cannula or a long tube that's also full of numbing med, and you basically, just like a plastic surgeon would do, you break up some of the fat cells and you suck them out of there. Once you have the fat cells and once you have the bone marrow, you run them through a filter that gets rid of things you don't want, like any pieces of bone, or you really don't want the fat cells per se. You want the stem cells there. So a lot of the fat itself is taken away. You run those in a centrifuge, and you end up with this rather pure extract of largely stem cells. And in the case of the bone marrow, hopefully stem cells. Older patients don't tend to have a lot of stem cells in their bone marrow, but they do tend to have a lot of growth factors. It's like hypercharged with growth factors, so it's useful for that. And we often we'll inject them together. They call it a fatty Mary, like a Bloody Mary. And from that point, it's very simple. You localize the joint. Hypothetically, it's your knee, for example. We'll clean the knee off. We'll make sure we're in the joint on the fluoroscope. So we'll numb it up, put a little needle in there, squirt a little dye, make sure that the dye is actually going through the knee joint. And once we've confirmed we're there, you put usually a little bit of the bone marrow fat cells, and you put a little of that PRP in the joint, and you let it go to work. So you've basically given for lack of a better word, you've given the raw materials and you've given the growth factors to kind of activate it and get it going, and then you wait. And if you watch the progress over the course of first the next couple weeks, but ultimately a couple months, and you see how somebody does. People ask a very honest question or a straightforward question: what's the success rate? Well, it's going to vary, of course, by a lot of things. Your age, your genetics, how bad the joint is, your expectations. Overall, talking to most regenerative medicine doctors and most studies, on the average of about 80 to 85% of people are very happy with the results. It's not always a slam dunk, per se. It's not always you're going to go from needing a knee brace or thinking about a knee replacement to dunking basketballs, but can you go from having a bone on bone and your knee limiting you to walking around comfortably and having a normal life? Yes. If you're a high level athlete, like I think the last guy I remember was Chris Johnson, the Phoenix Cardinals. He had it done. He went from, I think, being injured reserve to a couple months later back to full duty. So the results can be anything from really good to fantastic. We're always hoping for fantastic, and we try to do as many things as we can to optimize that for you.